Do you know you can take your penis to the gym and train it much like you train biceps or calves, so the tissue stays healthier, more responsive, and less prone to age-related decline? Stay with me, and I'll show you exactly how and why that works, what to use, how often to use it, and how to do it safely. Quick note up front for men who like natural support and stronger erections while they build good habits. You will find my 2 recommended supplement links in the pinned comments below. Now, let's start with the physiology. Testosterone is a key androgen that shapes masculine traits and supports libido, energy, focus, muscle mass, bone density, and mood stability. Men's testosterone levels are highest in their 20s and tend to decline gradually thereafter, about 1% per year on average, beginning somewhere in the 30s. That's an average, not a mandate. Sleep debt, excess weight, untreated sleep apnea, chronic stress, smoking, heavy alcohol use, and metabolic conditions, hypertension, high cholesterol, insulin resistance, can accelerate that decline. Conversely, good sleep, strength training, cardio, nutrient-dense food, and stress control help preserve healthy levels. What does testosterone have to do with exercising the penis? The erectile bodies, the corpora cavernosa, are specialized smooth muscle sinusoids with abundant androgen receptors. Think of an androgen receptor like a keyhole, and testosterone like the key. When the key engages the lock, a cascade of cellular signals promotes healthy smooth muscle tone, nitric oxide availability, and the ability of those sinusoids to relax, fill with blood, and compress the draining veins under the tunica albuginea, that tough sausage casing layer around the erectile tissue. That veno-occlusive mechanism is what keeps blood in the penis long enough for a firm erection. As men age and or if androgens are chronically low, the composition of the corpora can shift: less healthy smooth muscle, more collagen deposition, fibrosis. When there's more fibrosis and less compliant muscle, the tissue doesn't expand as well. The sinusoids don't press the tunica firmly enough. The emissary veins aren't compressed, blood escapes too quickly. Clinically, we call that veno-occlusive dysfunction, often labeled venous leak, and it's one of the most common mechanisms behind erectile dysfunction. The simple translation: if the erectile muscle isn't used, oxygenated, and stretched regularly, it can atrophy and stiffen, and erections become less reliable. Now for the gym part. You can deliberately engorge the corpora with oxygenated blood on a consistent schedule to keep the tissue supple, oxygen-rich, and capable of expanding. Spontaneous nocturnal erections do some of that maintenance for you. Intercourse and masturbation do as well. But as men get older, or when stress, illness, or life circumstances reduce sexual frequency, those workouts can happen less often. That's where a medical-grade vacuum erection device, VAD, commonly called a penis pump, becomes a practical tool. A VAD is a clear cylinder with a base that seals against the body attached to a manual or battery pump. When you place the penis into the cylinder and create gentle negative pressure, arterial blood is drawn into the corpora. Used correctly, you achieve a full, comfortable engorgement. That stretch and oxygenation are the exercise. Over time, regular sessions help maintain tissue elasticity, reduce hypoxia-driven fibrosis, and condition the veno-occlusive mechanism. You're not tearing muscle like in bodybuilding. You're training smooth muscle and sinusoidal tissue to fill and seal effectively. Here's how to use a VAD safely and productively. Choose a medical-grade device that fits your base well and comes with proper instructions. Trim pubic hair for a better seal and apply a small amount of water-based lubricant to the base. Insert the penis into the cylinder. Seat the base comfortably against the body. Avoid painful pressure on the scrotal skin and begin pumping slowly. The goal is a firm, comfortable engorgement, never pain, deep purple discoloration or bruising. Once fully engorged, hold for about 30 to 60 seconds. release the vacuum to let the penis rest, and repeat that cycle for a total of 10 minutes. Think intervals, not a single long hold. If your clinician, Dr. Laura, has advised a constriction ring for ED management during intercourse, you may apply it at the base after engorgement to maintain rigidity, but never wear a ring for longer than 30 minutes, and never sleep with it on. Frequency matters. For tissue maintenance and conditioning, aim for at least 3 sessions per week. Daily is reasonable for many men. If sessions are comfortable and brief, do not exceed roughly 10 minutes per session, and avoid doing more than 2 short sessions per day. Overpumping or marathon sessions don't help. They fatigue tissue and increase the risk of bruising or edema. If you experience pain, numbness, coldness, or persistent discoloration, stop and let the tissue recover. Gentle, consistent, oxygen-rich engorgement is the goal. You can combine the pump with other smart practices. A daily walk and 2 or 3 weekly strength sessions improve endothelial function and testosterone, which support erections from the inside. If you have a sedentary job, get up hourly. Pelvic blood flow benefits. Manage blood pressure, blood sugar, and lipids. Treat sleep apnea if you snore and wake unrefreshed. Moderate alcohol. Stop smoking. Those changes move the biggest levers for erectile quality. If your clinician, Dr. Laura, agrees, you can also pair a VAD session with a pre-session nitric oxide supporting supplement, like L-Citrulline from organic watermelon extract, about 30 to 60 minutes beforehand, to support inflow during your intervals. Use a base ring only if you've been counseled on correct selection, placement, and time limits. A few clarifications. A VAD is not a lengthening device. It conditions erectile function. For men hoping to add length, the only non-surgical approach with modest evidence is a dedicated penile traction protocol with a reputable extender worn for hours daily over many months, typically producing small average gains in flaccid stretched length. That is a separate therapy with its own cautions and should be done under medical guidance. Do not inject any substance into your penis for enhancement. Fillers, oils, and unregulated products can lead to ulcers, scarring, deformity, and delayed disasters years later, and cosmetic lengthening surgeries outside reconstructive indications remain experimental with significant risks. Let's return to the core, use it or lose it idea. Every time you achieve a healthy erection, whether nocturnal, sexual, or via a pump, you're perfusing and stretching the corpora, rehearsing the veno-occlusive seal, and signaling the tissue to stay compliant instead of fibrosing. If life has reduced those opportunities, schedule them. Think prevention and maintenance, not rescue after things have declined. Here's a simple weekly plan you can follow on 3 to 5 days per week. Do a 10-minute VAD interval session, slow pump to comfortable engorgement, hold 30 to 60 seconds, release and repeat. On 2 or 3 days, add brief pelvic floor awareness. During the rest period, practice 2 sets of 5 slow, gentle pelvic floor contractions, as if stopping urine midstream, each contraction lasting 3 seconds, with a full 3-second release. No squeezing glutes or breath holding. Walk 30 minutes most days, and do 2 strength sessions, push, pull, hinge, squat. Sleep 7 to 8 hours, nightly, and protect a wind-down routine, so morning erections have a chance. If you and your clinician, Dr. Laura, decide a constriction ring is right for intercourse, practice application and removal during a VAD session so you're smooth and safe in the moment. Remember the 30-minute max rule. Common questions I hear: will pumping make me bigger? It can make you temporarily fuller due to engorgement. The durable benefit is better erectile quality, not permanent size increase. Can I overdo it? Yes, more is not better. Pain, dark bruising, or persistent swelling means you're pumping too hard or too long. What if I'm on blood thinners? You can still use a VAD, but you must be gentle and clear it with your clinician. Bruising risk is higher. I have Peyronie's disease. Does a pump help? VEDs can be part of a multimodal plan for Peyronie's under urologist supervision, often alongside traction and medications. Don't self-treat significant curvature without guidance. One last word on hormones. If you have symptoms of low testosterone, low desire, low morning erections, fatigue, loss of muscle, depressed mood, get evaluated. Correcting sleep apnea, losing visceral fat, and training consistently can raise levels. Some men will still qualify for carefully monitored testosterone therapy. That's a medical conversation, not a supplement aisle decision, and it must include fertility goals, prostate screening, hematocrit monitoring, and shared decision-making about risks and benefits. You can absolutely exercise your penis. Do it gently, consistently, and safely. Keep the tissue perfused and pliable. Protect the veno-occlusive mechanism, and combine your gym plan with the lifestyle levers that improve blood flow and hormones. That combination, not a shortcut, keeps erections strong across the decades. As promised, for men who like natural support while they build these habits, 2 options patients often ask about are organic watermelon extract, L-Citrulline, to support nitric oxide and circulation, and an advanced performance formula that combines acarine, tonkat, ali, fenugreek, nettle, and zinc to support erections, stamina, testosterone, and prostate health. They won't lengthen the penis, but they can complement your sleep, training, and VED work by assisting blood flow and sexual energy. You'll find links in the comments and in the video description.